Is a 24/7, 365 initiative that works to destigmatize talking about mental health. We have a great show planned for you. We have Dr. Jenn White joining us to talk about COVID-19 updates, as well as Lori Woodley from All It Takes to talk about emotional literacy, as well as the impact of COVID isolation on children. I wanted to start the show by talking about deaths by suicide. We're hearing more about them in the news, and suicide is absolutely something that is preventable. So I want to just call out that at the end of the show, we will be providing support, websites, and numbers for those that might need some extra care. Now, when we're talking about death by suicide, we want to make sure that we're not leading what can be caused and called social contagion. And that means that when in the news we talk about death by suicide, there are sometimes an increase in rates for vulnerable populations. So we want to be thoughtful about always talking about how to prevent and also not talking about details. Now, there's a lot of risk factors that we are aware of that do lead some vulnerable individuals to use suicide as a method of taking their own life. And that is things like depression, addiction, also serious levels of pain, as well as previous attempts and a family history. Now, there are ways that we can prevent such things from happening. And just like the purpose of the show, talking about and familiarizing ourselves with asking about individuals' mental health is one of the number one ways that we can prevent. And that's why I'm telling everyone to consistently ask those that you care about and those around you, how is your mental health? That's the way that we normalize both asking, discussing, and hearing about how we are all doing on a mental health level. And that will definitely improve things and reduce rates. We also want to make sure we're reaching out to individuals, those that are close to us, but also those that feel distant and might have drifted away, because sometimes people isolate, and that also is a risk factor. And as always, we do want to focus on trying to eliminate and reduce social causes, such as bullying, and also the impact we have culturally on marginal identity people, such as people from the LGBTQIA community, who often have higher rates of death by suicide. And finally, even gender. People that are male identified also have higher rates, and that's often rooted in toxic masculinity, sexism, which doesn't support people that are male identified talking about their mental health and really feeling at peace with expressing vulnerability and maybe a need for some mental health care. So this is something that we absolutely can prevent. We just have to be more confident talking about it, asking questions, and also knowing the signs and the risk factors. Now let's go to our first guest, Dr. Jenn White. Dr. Jenn, how are you?
I'm good, Chris. Thank you. How are you?
I'm a little bummed. California, we just started the rollback. Just as I thought there was like a little bit of a light at the end of the tunnel, we're doing a little bit of a rollback over here.
Yeah, unfortunately. You know, I was just saying that I think it's going to be very difficult to get this virus under control until we have a solid therapeutic and a vaccine online because, you know, we're experiencing such different things on different sides of this country. Whereas, you know, the last time we spoke, New York and the tri-state area were more of the epicenter of this disease. It's now really shifted dramatically to the other coast, to California, to Texas, to Arizona, Alabama, some of these, South Carolina, some of these, states are experiencing very large numbers of COVID-19 in places that people didn't think it was a reality because they only saw it on, television or on different media sources of hitting different areas. Once it hits your area and you know people that are affected, it starts to become more of a reality. So I think Governor Newsom made a good call. It's just incredibly frustrating for a lot of people because, Chris, everyone has quarantine fatigue and a lot of people feel like enough is enough.
Yeah, I'm definitely happy we have Newsom. He's definitely making the tough calls. What are your thoughts about vaccine? I keep reading different thoughts. So I guess give us your on record, off record. When do you think at best and at soonest we could see something?
There are a lot of global efforts right now towards the vaccine. We've seen a lot of different studies coming from different areas across the world, essentially working very diligently, trying to come up with a vaccine. There was a very good study in the New England Journal this morning out of the University of Seattle, where they showed a very robust neutralizing antibody response to one of these vaccines. It was a double dose, and people who took the vaccine, there were 45 volunteers. The immune response was very robust and stronger than someone who has just been affected by the disease. The amount of immune response the person was able to mount was significant. So that is a great study. There have been studies on, different mammals, on pigs, on chimpanzees, on mice. There have been other studies on a lot of human, volunteers. The issue is how quickly can we streamline one of these vaccines through the FDA? And then once it's approved, Chris, of course, the challenge is going to be ramping it up to provide it for an entire population. Will we be at capacity to roll this out? My thought is, just from reading all of the research, that we will see something viable, hopefully in the fall, definitely by the end of 2020 in December, but it may only be rolled out to first responders and very vulnerable people. Will we be able to roll this out nationwide by the end of 2020? Probably not, but hopefully, if all goes well, Chris, if some of these are efficacious, some of these efforts are efficacious and they work well, hopefully by the new year, we're going to see some other, tricks in the bag, the trick bag in our arsenal to fight this virus.
Okay, I can take that. That's not bad. That's not bad news. We've been in this for so long thus far. You telling me the end of the year, maybe the beginning of New Year, like I can hang in that long. And we don't have to unpack this, but the only people who are going to be worried about that point are the anti-vaxxers. So we're going to have to figure that one out.
And of course, that's going to be a challenge also. And there, it's funny because I've spoken to a lot of doctors actually who will probably be offered this vaccine early on before all of the human trials are back in. They may be used in human trials. And some of the doctors feel like they would rather, take their chances with COVID-19 and not be vaccinated with a vaccine that has been widely tested. Remember, we're really pushing this vaccine effort to go through very quickly. You usually see years and years of clinical data before it's launched, in a widespread capacity like this. That's going to be another issue. But hopefully, all eyes are on this vaccine effort. All global eyes are on it. Hopefully the World Health Organization, the CDC, and other public health institutions, that we can make sure this is going to be safe once it is rolled out for the general public.
Okay, and let's weigh in on this one. Here's another controversial topic. So God bless our Secretary of Education. Yeah, exactly. That's my thought as well. Here in the OC, the Department of Education just voted to send kids back to school, and wait for it. There's going to be no use of masks, and they're not going to mandate social distancing. Then we have Missouri, who has students signing and families signing death waivers. So weigh in on, I know, it's heartbreaking. I'm not behind this, but I want a medical expert to weigh in on this. So what is your opinion about our readiness to go back to school and the safety of such a thing?
This in itself lies our biggest challenge as a society, right? We know that we want to get our schools back. The government is pushing to get the schools back in person because it's a way to jumpstart our economy. Parents can't work if their kids are home. It's one of those catch-22s. But from a medical standpoint, these college campuses are going to be massive places for infection. There are so many points of contact, Chris. You're talking about a population that has an invincibility complex. Even if you social distance these kids and take the measures that need to be taken, right? If you social distance, if you wear masks, if you do, stations that have Purell and other hand sanitizers, the professors are teaching behind plexiglass at some of these universities. That's some of these plans. This is going to be a major challenge for this country moving forward. And in my opinion, and we've seen it already, it's not just Missouri. You've seen football teams come back in Texas and Alabama. Those kids were tested, and many of those students were coronavirus positive. Even though these populations are low risk, remember, we've seen all cases where people in their late teens, 20s, 30s have gotten sick with no underlying risk factors, and we've all scratched our head. The overwhelming majority of people getting very sick with this disease remains people that are elderly, remains people that are immunosuppressed. However, there are these outlier cases that we can't predict. But these kids are vectors, and they can infect the working population on the college campuses. They can affect the professors, and then you have a super spreading event. Can you quarantine these kids in a place, if you have a building that's just a COVID-19 building on a college campus? And then what about the health centers, Chris? The Washington Post just ran a very interesting article about how health centers are not the most robust models for health treatment in this country. A lot of health centers on college campuses are not affiliated with hospitals, especially on small campuses, and they're easily overwhelmed with the flu or with a rise of measles on a college campus. Imagine a major outbreak of COVID-19. So I think we need to tread very carefully. The CDC has outlined a plan to get us back online. I know that President Trump is now undermining this plan and trying to undermine Dr. Fauci, which is also contributing to a lot of confusion. But I think that in order to get these universities up and running, we must maintain social distance. the students need to be spaced properly. You need to have hand sanitizing. You need to have masks without a doubt, or we're going to see real outbreaks in real centers for this continue to perpetuate through the fall into the winter, without a doubt.
Yeah, lives matter. And when I'm looking at the percentage that Betsy DeVos threw out there as to how many people would pass, even one is too soon for me. And even a mental health perspective. Look, education's important, but people's physical health and a pandemic have to come before that. So, Dr. Jenn White, thank you so much. People can find you across all socials at Dr. White and at drwhite.com. Thank you, as always, for being a part of the show.
Thanks so much.
Have a beautiful night. As always, I always agree with Dr. Jenn White, and I think that's such a valuable point. Education's important. I want people to get all the resources they need, but we do have to be thinking about the fact that we are in a pandemic, and this is possibly something that's spread, and the numbers continue to soar. So still got work to do. All right, let's go to our next guest, Lori Woodley, founder and CEO of All It Takes. How are you? Welcome to the show.
Hi, Chris. Thank you. Great to be here, and I'm doing well. We're in crazy times, so
It's an understatement.
Minute by minute.
Yeah, it's an understatement. I thought we were pushing forward. Newsom rolled us back, as he should. But the light at the end of the tunnel kind of dimmed a little bit, but we're hanging in there, right? We're going to be fine out here. So I was looking at your website, and not only is it beautifully comprehensive, and I want to hear more about the work you do, but I loved, you had a few mission statements on there that I love, but one of them I wanted to just quote, because this is actually the work I try to do in the world, and what I really want people to be inspired to do as well. Is you said, each of us has a responsibility to humanity and our planet to be part of a sustainable, positive change. And I love that. And it looks like a lot of the work you do is around children. And I think that, as they say, that's a really beautiful foundational place to try to start some of the skill building that we need. So tell us a little bit about what All It Takes does.
Well, just as you read there, we are, about purposeful action. And we believe that we can inspire kids, actually empower them to do this young. In fact, I come out of 28 years as a school counselor, and our kids are so resilient and they have so much capacity that we are not really tapping into. And so often we don't give them the credibility for the power and the amazing pieces of life they can offer. And so I believe in that. And so we teach from that. And what happens is they rise to every occasion, always. And, they're going to be our future. They're, 25% of our current population and 100% of our future. How can we not be investing in them fully right now?
Yeah, 100%. And just on the later in life end, as someone who does a lot of marital and couples therapy, I unfortunately see the impact of a generation or a culture that we raise that doesn't have a lot of emotional literacy, communication skills. And I saw that that's also something that's a big part of your program. So talk to us about that. I loved the key words, because you said that thriving and the program is about looking at excellence around socialization, academics, but also emotional health, teaching empathy and compassion. That warms my heart, because we need so much more of that.
Yeah, that's really my wheelhouse, is emotional literacy, social emotional learning, emotional intelligence, whatever you want to call it. And, compassion is empathy in action. And I am concerned. Over 28 years, I left education to do this full time, because I'm concerned about the amount of kids not capable of taking ownership of their lives at 18. That doesn't mean that they're independent and don't need us anymore, but that they have the resolve. They know they're 18. They know life is kind of in their hands to direct. And they're really not, in my opinion, not prepared for that way too often. And we see it in, first year college dropouts at alarming rates. We see it at, parents I work with have their kids at 25, 28, 30 sitting on their couches. And, I'm all about being in support of each other, but serving our kids and not saving them, because life is hard. Look at the pandemic we're in right now. It's hard. And it is. We're not changing what is. What we can change is how we deal with what is, and the capacity we have to do so.
And I just like what you said in the beginning as well. We're recognizing that children have more resilience, where I believe we often live in a culture where we disregard the capacities that children have and we really downplay them. So I like the idea of really kind of instilling more.
Yeah, and we can teach it. And then when you give them the space, the amount of feedback they can give us is so fabulous. They see so clearly what's really happening. They can articulate what they're feeling. It's more us not really giving them the space to explore those things. And when we do give them the space, when we step back and understand that they have something to say, if we invite them in rather than push them away, then we find magic because they're so elevating for us.
And right now, talking about COVID-19 and the self-isolation with the pandemic, what are your biggest concerns with the impact it's going to have on children?
My biggest concerns, besides all the ones that we're seeing, we're worried about some kids are safer in school than they are at home. I mean, those are just alarming physical concerns. But my concern is, and my hope, I need to say, and my hope is that we won't give them the emotional intelligence boost that they need right now. That instead of taking this time as a precious moment that maybe we wouldn't have asked for, but we have, to elevate their capacity, to teach them to cook, to teach them to be a contributor around the household, to teach them, to explore the nuances of who they individually are. That my concern is that we won't use this time to really help develop those skills. The academic piece is by district across the nation. That's varied, how well schools are equipped to handle it. But what we have at home is an ability to help them understand their efficacy and step powerfully into their purpose and their possibility. And I'm hopeful that that can happen, and nervous that maybe it won't happen as much as we would wish.
Yeah, I'm with you on that. And sadly, some of the outcomes, positive or negative, we're not going to necessarily see them as of yet, but we will soon. And, just before we close out, all it takes, you offer a lot of resources. So there's things there for educators, things there for families, and it works to also serve youth and youth influencers. That was interesting to hear about the youth influencers.
Yeah, youth influencers are anybody who has any kind of reach to kids. If you're a piano teacher for 50 minutes a week, you have, in my opinion, an obligation to be a part of elevating their potential. And if we have them for 6 hours a day as a teacher, if we have them on a sports team, and of course, us as parents, we have this beautiful opportunity to be a part of their social emotional development. And there's a lot of finger pointing. That's the parent's job. That's the teacher's job. How come the principal's not doing it? And if we could embrace that it's all of our job to really help our kids see what they are capable of, and then really help them with a hand out, but not a saving of them, every one of us together can really lead a future of youth who step into being able to navigate their world and our world, because they will be taking care of us.
Yeah, and thank you for saying it like that, because I think I agree with that wholeheartedly. More of a collectivity-based mindset where anytime you interface or interact with another human being, especially a child, you have the capacity to positively influence them. Let's take that seriously and take that accountability.
Yeah, I believe it's a mandate.
Beautiful.
Let's do it.
Allittakes.org is where people can go to get more information. Lori Woodley, thank you so much. And also thank you for everything you're doing.
Thank you, Dr. Chris. Really appreciate the time with you.
Have a good
night. Afternoon.
Bye-bye.
All right. Thank you. Bye.
All right. That's what I wanted to come out of this pandemic, is that whole message of collectivity where we are looking at the impact we're having on others, and children absolutely need more respect, but also more support from us, helping work on resilience. So I love organizations like that. So definitely check out their information. We'll be back next week, Thursday at 5 p.m. Pacific. That's 8 p.m. Eastern. If you want to check out past episodes, you can do so by going to all the radio.com handles, Twitter, Instagram, YouTube, and Facebook. As always, thanks for hanging out with us. And for those that need extra care and support, we're going to have some resources at the end of the show. As always, thanks for hanging out with me, and have a beautiful, beautiful night.